Welcome to the deep dive. Today we're taking a close look at the International Monetary Fund, the IMF, and its impact really on social safety nets across the globe.
Yeah, it's a big topic. We're
Mm.
drawn on quite a bit of research, but focusing particularly on this book, A Thousand Cuts, Social Protection in the Age of Austerity. It's quite revealing.
It really is. Now, the IMF, as you probably know, steps in when countries hit economic trouble. They offer financial help, but, and this is the crucial part, there are often strings attached, conditions.
Exactly. Those conditions are key. And look, trying to grasp global finance, it can feel overwhelming, right? So our aim here is to pull out the really vital stuff from the research, especially A Thousand Cuts.
Focusing on how these IMF conditions affect things like government spending on health and income inequality, big issues.
Huge. And we're covering a long period, basically 1980 right up to the present, even touching on the initial response to the COVID pandemic.
Okay, so before we dive into the conditions themselves, maybe a quick refresher on the IMF. Who are they?
Sure. So headquarters are in Washington, D.C. The current managing director is Kristalina Georgieva.
And the staff, lots of economists, right? Technocrats.
That's the term often used, yeah. Highly trained economists. The big decisions, though, come down to the Board of Governors representing all member countries and the Executive Board, which is more hands-on day-to-day.
But the power isn't equal, is it? That's important.
Not at all. Voting power is tied to how much money a country puts in. So bigger economies, like the U.S., have much more weight.
Right. The U.S. is the biggest single share.
And for major decisions, they need an 85% supermajority, which basically means the U.S. holds veto power. So that structure, it definitely shapes the IMF's direction and the kind of conditions they favor.
Okay, got it. So that brings us to austerity in these conditions. Austerity, basically, government trying to balance its budget, right? Cutting spending, maybe raising taxes.
hmm And there are different justifications given for it. Pragmatically, if a country's in a balance of payments, crisis, spending way more than it's earning internationally, austerity is seen as a way to free up cash to pay debts.
Like tightening your belt at home if you're overspending.
Sort of, yeah. But there's also an ideological angle. Some economists argue for a smaller government role, believing the market is more efficient. Austerity is seen as a way to kind of reset things, let wages and prices adjust, make the economy more competitive.
John Cochrane, an economist, sort of framed it as government spending just shifting activity from the private sector, not necessarily creating more overall.
Right, that's one perspective.
But austerity gets a lot of criticism too, and a thousand cuts definitely leans into that. A big worry is focusing on short-term budgets harms long-term investments, like health.
Exactly. It can weaken those safety nets you need, especially in a crisis. Think about COVID-19. If your health system's been cut back for years, how do you respond effectively?
And what about the impact on people? Inequality.
That's a major concern. Critics argue austerity often makes inequality worse, increases poverty, and frequently hits women hardest.
We've seen protests too, right? Pakistan, Jordan, people pushing back against these cuts.
Absolutely. A lot of social unrest globally has roots in resisting austerity, specifically IMF-mandated austerity. And just to be clear, IMF conditionality, that just means the specific policy changes a country agrees to make to get that loan.
Okay. So loans with conditions, often pushing austerity. What does A Thousand Cuts say about how this actually played out between, say, 1980 and 2019? Did the IMF change its tune over time, like they sometimes claimed?
Well, this is where it gets really interesting. The book argues that despite the talk about evolving, the research doesn't show a fundamental shift in IMF practices on the ground.
So a gap between words and actions.
Pretty much. The authors call it organized hypocrisy.
Organized hypocrisy. Okay, what does that actually look like?
It involves things like rebranding initiatives, putting out fact sheets that maybe paint a rosier picture than reality, creating new policies
Yeah.
that sound good but aren't really enforced or integrated properly. It's a way to deflect criticism, protect their reputation, without fundamentally changing how they operate.
Because admitting mistakes or changing course after decades could damage their credibility.
Precisely. It's like an escalating commitment to that hypocrisy.
Yeah.
Easier to tweak the messaging than the core approach.
Right. So how widespread was this conditionality? The book has a map, doesn't it? Figure 2.1.
Yes, it's a great visual. It shows the total number of conditions per country from 1980 to 2019. Darker colors mean more conditions, often from multiple loans.
Which countries had the most?
You see places like Armenia, Kyrgyzstan, Malawi, Pakistan, Romania. A lot of West African nations really stand out with heavy conditionality burdens.
And it varied a lot.
Hugely.
Yep.
Mauritania, for example, had IMF programs for 30 out of those 40 years, racking up over 1,000 conditions.
Wow.
Whereas South Africa had just 1 year, 11 conditions. Lithuania was about average. And mostly, wealthier developed countries had none because they weren't borrowing. Though there were exceptions, like Greece, Ireland, Portugal, after the financial crisis.
And the actual number of conditions per loan, did that go up or down over time?
Table 2.1 shows that. It fluctuated. Started around 12 in the early 80s, peaked at over 40 in the mid-90s, stayed high till about 2007.
Then it dropped after the global financial crisis.
Yeah, it dipped down to around 32. But interestingly, in the last decade or so, it's bounced around again. And even though the median dropped, we saw a rise in programs with really high conditionality, 60-plus conditions in places like Afghanistan, Bangladesh, Bosnia.
So the really intense programs didn't vanish.
Not at all. And the median actually jumped back up to 44 in 2018, which was the third highest level ever. So maybe a slight dip overall, but intense conditionality persisted.
Okay. And the book also looks beyond just the big economic numbers, right? Conditions on things like state-owned companies, SOEs.
Yes, figure 2.3 covers these non-core areas. SOE reforms. Government-owned businesses started getting attention in the early 80s, peaked in the late 90s, probably linked to post-communist transitions.
Have they declined since?
Somewhat, but they're still around. Recent examples include privatization strategies in Congo-Brazzaville, reforms in Pakistan, Sri Lanka. Even some Eurozone countries had IMF conditions about privatization.
And what about things like institutional reforms, making things more business-friendly?
Yeah, that became common in the early 90s. Changes to legal systems, competition law, business regulations.
Yeah.
Dipped after the financial crisis, but pretty steady since 2012.
Mm.
You see examples in Tunisia, Ukraine, Cote
The
d'Ivoire.
labor issues, like wage bills.
That grew in the mid-90s. Limits on how much governments could spend on public sector salaries peaked around 2005, then became less frequent.
But they still exist.
The research suggests, yes, sometimes as actual conditions, like in Ghana or Honduras, or sometimes framed as non-binding benchmarks.
Which still sends a strong signal, presumably.
Exactly. And you also see things like civil service, restructuring, reorganizing government jobs in places like Serbia or Liberia. So the IMF's reach goes beyond just the headline budget numbers.
This gives a really detailed picture, but the big question is, how do we know these programs caused certain outcomes, like lower health spending? It seems incredibly complex to prove that link.
You're absolutely right. That's the central challenge establishing causality. You have this problem called selection bias,
Meaning?
meaning the countries that choose IMF programs are probably different to start with in ways we can see, like their economy, but also in ways we can't easily measure, like political will for reform.
So if health spending drops, you can't automatically blame the IMF program because maybe it would have dropped anyway due to those other factors.
Precisely. It's like comparing apples and oranges unless you account for those initial differences. You need to isolate the effect of the program itself.
So how do researchers try to do that? What tools do they use?
Well, one approach mentioned is matching. Basically, you try to find a country not in an IMF program that looks as similar as possible on paper to a country that is in a program.
Creating a kind of control group.
Exactly,
Yeah.
to make the comparison fairer. Find two similar apples, give one the IMF sticker, see if that sticker itself makes a difference later on.
Okay. And the book also mentions an instrumental variables approach. Sounds technical.
It is a bit more complex. The idea is to find something, an instrument, that influences whether a country joins an IMF program, but doesn't directly affect the outcome you're studying, like health spending, except through that IMF program participation.
Okay, what kind of instrument could do that?
1,000 cuts. Uses the IMF's own budget constraint, basically. How much money the IMF has available to lend out at any given time.
How does that work?
The assumption is that changes in the IMF's overall lending capacity shouldn't directly impact, say, a specific country's health spending unless it influences whether that country takes an IMF loan with conditions. Figure 3.2 shows the trend in IMF lending capacity seems to track alongside program participation, lending some support to this idea.
Interesting. So it's a way to try and get around that selection bias problem.
It's one of the sophisticated statistical techniques they use to try and isolate the IMF's specific impact.
Right. So using these methods, what does 1,000 cuts find about the impact on health policy? Specifically, government health spending.
This is a really key area, and the findings here are quite stark, sometimes contradicting the IMF's own research.
How so?
Well, studies by IMF staff often conclude their programs either boost health spending or have no real effect. But independent researchers, including these authors, find a more mixed and often negative picture.
Like the author's own study on West Africa.
Exactly. Their 2017 study found that each additional IMF condition was linked to a decrease in government health spending per person in West Africa.
That's quite direct. Are there other examples of conflicting findings?
Yes, a striking one. The IMF published a study looking at low-income countries from 1995 to 2014, saying their programs had no statistically discernible effect on health spending.
Okay.
But when the authors of 1,000 Cuts reanalyzed the exact same data using the same controls, they did find a statistically significant link between IMF programs and decreases in health spending.
Wow. Same data, different conclusion.
Yeah. Their reanalysis suggested that an extra year under an IMF program was associated with about a 1.7 percentage point drop in health spending as a share of GDP. That's a significant difference.
Definitely. So what does health spending look like globally during this time? The maps in the book show this.
They do. Figure 4.1 shows health spending as a percentage of GDP in 95 and 2017. Lots of variation. Not many countries spent over 8% in 95, but more did by 2017.
And spending per person, figure 4.2.
Again, huge variation. Norway, US, Luxembourg spending thousands per person in 2017. Somalia, DRC spending just a few dollars. In those very low spending countries, international aid often fills big gaps.
How does this connect back to IMF conditionality levels?
Figure 4.3 compares trends for countries with above average conditionality versus below average. The finding: while trends were similar, the countries with fewer conditions consistently spent a higher share of their GDP on health.
And that gap widened over time.
It seemed to, yes. And a similar pattern holds for spending per person. The difference between the high and low conditionality groups grew between 1995 and 2017.
Okay, that suggests a link. Does the book quantify the impact of the number of conditions?
Yes. Table 4.4 does the statistical heavy lifting. It finds a significant negative effect. Each additional binding IMF condition is linked to about a 0.039 percentage point drop in health spending as a share of GDP.
And are certain types of conditions more impactful?
It seems so. The analysis points to quantitative conditions, those specific numerical targets, as the main driver, more so than the structural ones about laws and institutions. Interestingly, just having an IMF program, the dummy variable, didn't show a significant effect on its own in this model.
Right, it's the conditions themselves.
That's what this suggests. Figure 4.8 and Table 4.5 reinforce this, showing that negative link between binding conditions and health spending per person.
And did they look at which policy areas within the conditions mattered most for health spending?
Yes. Figures 4.9 and 4.9 break that down. Conditions related to fiscal issues, government revenues, and taxation showed a significant negative impact. Others like finance, debt, institutional reforms also trended negative, but with less statistical certainty.
Any surprises there?
Maybe slightly. Conditions around privatizing state-owned enterprises actually showed a slight positive, though not statistically significant, link.
The book also zooms in on West Africa, right?
Yeah.
A region with high conditionality.
It does. Figure 4.11 highlights countries like Senegal, Côte d'Ivoire, Ghana. Table 4.7 looks at targets for social spending there, and Table 4.8 examines how well conditions like social spending floors versus budget balance targets were actually implemented. Implementation varied.
So what's the overall conclusion for health spending?
The research concludes that IMF conditionality, especially those quantitative conditions on labor and fiscal policy, contributed to lower government health spending globally. In West Africa, they pinpoint pathways like tight macroeconomic targets, reducing fiscal space, wage bill limits hindering hiring, and problems with decentralization.
Okay, so a clear negative link to health spending. Let's switch gears to income inequality, another huge issue. What does 1,000 Cuts say about the IMF's role there?
Chapter 5 tackles this head-on. They look at the Gini coefficient thing, the standard measure of inequality, and also how austerity affects different income groups.
And the main finding?
Overall, IMF policies tend to increase income inequality.
What drives that?
Conditions related to trade liberalization and exchange rate changes seem to be key factors, possibly due to disruptions to local industries or a focus on foreign investment that doesn't always benefit workers equally, at least initially.
And what about the austerity policies themselves? We touched on this, but how do they impact different income levels?
The analysis suggests austerity disproportionately hurts lower income groups, and perhaps counterintuitively can sometimes benefit the very top earners.
Widening the gap.
Exactly. making inequality worse.
The book maps inequality too, doesn't it? Figure 5.1.
Yes, showing the Gini coefficient over time 1980, 1990, 2010, 2017, you see big regional differences and changes within countries. Western Europe, Japan started relatively equal in 1980, Latin America, Southern Africa much less so. The maps show how these patterns shifted.
And figure 5.2 compares high versus low conditionality countries again.
Right, tracking the Gini coefficient trend for those two groups.
How do they measure the intensity of austerity for this analysis? It seems hard to quantify.
They used a specific data set on IMF fiscal conditionality, looking at the implied change in the government's budget balance required by those binding quantitative conditions. It gives a measure of how hard the IMF was pushing for fiscal cuts.
And when they linked that austerity measure to inequality.
They found that IMF-mandated austerity tended to concentrate income at the very top, the richest 10%, while the middle class and lower income groups saw their share of national income shrink the most.
So the conclusion on inequality.
The conclusion is that IMF interventions, driven by both austerity and those external sector conditions, increased within country income inequality globally between 1980 and 2017. And the authors warn these effects could be long-lasting, entrenching inequality.
So we've seen impacts on spending, impacts on inequality. What about actual health outcomes, people's well-being?
Chapter 6 connects those dots. It argues conditionality affects health through the social determinants of health.
Okay, remind us what those are.
It's all the stuff beyond just doctors and hospitals that affects our health, our jobs, income, early life experiences, social exclusion, food security, housing, social support, all those broader factors.
And Table 6.2 maps conditionality types to these determinants.
Yes, it lays out how different IMF policy areas could potentially impact things like work, unemployment, early life conditions, addiction, food access, and so on.
What specific links did they find?
They highlight the connection to work and unemployment. We know some IMF conditions, like labor market reforms, have been linked to weaker worker rights, lower incomes, job losses, more inequality, things like public sector pay freezes or hiring restrictions.
And unemployment has known health impacts.
Definitely. Increased stress, risk of alcoholism, suicide. It's well documented.
What about direct health measures, like infant mortality?
Figure 6.2 looks at neonatal mortality trends, deaths in the first month of life. Figure 6.3 tracks the Universal Health Coverage Index. An interesting finding here is that countries with higher conditionality seem to make slower progress on improving universal health coverage.
Did the statistical analysis back that up?
Yes. Table 6.5 shows a statistically significant negative impact of structural conditions, the policy and institutional reforms on the coverage of essential health services. Figure 6.8 visualizes that.
Which specific types of structural conditions seemed worst for health outcomes?
Figure 6.9 and 6.seg look at that. Privatizing state-owned enterprises, labor reforms, and those broader institutional reforms show detrimental effects on both health service coverage and neonatal mortality.
So those seem to be key drivers.
They appear to be, though interestingly, external sector conditions seemed linked to slightly better health coverage. But overall, the conclusion is that IMF structural conditions undermine universal health coverage and are linked to higher neonatal mortality. Price increases for essentials, sometimes part of institutional reforms, might also play a role.
And they connect this to the Sustainable Development Goals, SDG 3 on health.
Right. Table 6.6 shows how conditionality negatively relates to multiple SDG 3 indicators. Maternal mortality, child mortality, malaria, hepatitis B, vaccination rates, health worker density, deaths from poisoning, unsafe water. It's quite a list.
Any positive links?
Just one, interestingly, smoking prevalence was lower, possibly due to tobacco taxes, sometimes included in conditions.
So a pretty concerning picture overall. Now, what about the COVID-19 pandemic, a massive global shock? Did the IMF change its approach then? We heard rhetoric about spending, right?
We did. Initially, the messaging from the top, from Kristalina Georgieva, was encouraging, spend what you need to recover, invest in people.
But did the reality match the rhetoric? What do the projections show?
That's where figure 7.1 comes in. It shows the IMF's own projections, suggesting that by 2023, many countries, especially low and middle income ones, were actually expected to face fiscal contractions, spending cuts.
Cuts, even after the pandemic's economic hit.
Yes, projected spending below their 2010s average, affecting potentially over 2 billion people.
So a return to austerity seemed likely for many.
That's the trend the data suggested. The book even classifies the projected adjustments, some moderate, some aggressive austerity, using Jordan as an example of the latter.
And what's driving that pressure for cuts? Debt.
Figure 7.3 suggests debt servicing is a big factor, particularly private sector debt in middle-income countries, putting pressure on government budgets.
What about the actual IMF lending during the pandemic? Did it come without conditions initially?
Table 7.1 shows a shift. At first, more lending was through emergency facilities like the Rapid Financing Instrument, which have fewer or no traditional conditions.
But that changed.
Over time, yes, there was a move back towards more standard loan programs, like the Extended Fund Facility, which do come with policy reform requirements.
And the book looked at some specific post-COVID programs, Ecuador, Kenya.
Yes, Ecuador, Kenya, Madagascar. The finding was that these programs still included significant austerity measures and structural reforms, privatizations, civil service restructuring, business as usual in some ways.
Concerning for places like Kenya where poverty had increased.
Very concerning. And while some programs had social spending targets, they were often non-binding, aiming just to maintain levels, not necessarily increase them to meet pandemic-related needs.
So the overall assessment.
The book concludes the narrative of the IMF abandoning austerity is dubious. It looks much more like a return to their standard pre-pandemic playbook.
Okay, so bringing this all together, looking forward, what's the main takeaway? The book isn't saying the IMF shouldn't exist, right?
No, that's crucial. It's not about no IMF intervention, it's about how they intervene.
Yeah.
The research strongly suggests that the way conditionality has been applied over decades has had damaging effects on social protection, health, and inequality.
And those patterns seem to be continuing post-COVID.
That's the worrying part, yes. The issue is the nature of the conditions and whether their socioeconomic impacts are properly considered.
Are there other angles to consider here? Human rights, politics?
Definitely. The book mentions human rights arguments that austerity can undermine economic and social rights. The UN Human Rights Council has criticized the IMF for sometimes neglecting these distributional consequences.
And the politics, the power structure we talked about earlier.
That's key too. The IMF is influenced by its most powerful members, mainly Western nations. The skewed voting power, the U.S.-Europe leadership deal, using the IMF for foreign policy, aims these political realities shape the fund's actions.
This has been, well, a really thorough deep dive. 1,000 Cuts paints a complex and often critical picture of the IMF's role.
It really does. It highlights just how intertwined global finance is with the daily lives and well-being of people and the need to scrutinize the impacts of these policies.
So a final thought for you, our listener, to take away. Given this evidence, what responsibility do international financial institutions and the countries that govern them have to ensure their assistance actually helps rather than harms people's well-being and equality? Are there better ways to support countries in crisis?
Big questions, ones that definitely need more discussion.
Indeed. Thanks for joining us on the Deep Dive.